Hi, I'm Dr. Desai. I'm a board certified practicing plastic and cosmetic surgeon and hair transplant surgeon. I'm into practice since 21 years. I've graduated from Sir JJ Group of Hospitals. And basically, my areas of interest are hair transplant and aesthetic procedures, whether surgical or non surgical. Now, we are going to be talking about a very common topic out here, which is hair loss. Hair loss was considered often a disease which was mainly seen in men, but over the years, it is a problem which is also seen a lot in women. So, what are the factors here? Mainly hormonal patterned hair loss or hereditary factors are considered as the main factor for hair loss. So, you're genetically predetermined, or because of hormone changes, you have a tendency to get hair loss. But there are many other factors which lead to increased hair loss, like your dietary habits, your nutritional deficiencies for vitamins, minerals, etc., stress factors, your lifestyle, late sleeping hours, irregular meal timings, not proper nutrition, and so many other medical conditions can actually give rise to hair fall. For a patient, it becomes often confusing to understand this pattern or androgenic alopecia or hereditary or hormonal alopecia from other kinds of alopecias that we see, which are non-androgenic or non-patterned hair loss. So there are so many different conditions, and often patients go to internet to understand this. It's always good to consult a specialist who's either a plastic surgeon or a dermatologist in order to understand what is the root cause of hair loss and accordingly what medicines are going to work in your case. Sometimes you'll be surprised that you don't need anything much, but just some basic medication, some basic vitamins, maybe one or two applications, and just a modification of lifestyle, and that itself would reverse your hair loss. So, yes, please consult. 21 years of my practice, I've seen patients often being misguided by a lot of things given on the internet, which may not be accurate or they may not interpret it accurately. Hence, always consult a proper board certified either dermatologist or a plastic surgeon. Get proper knowledge of your hair loss, why it is occurring, get proper diagnosis done. We may need to do hormonal tests, we may need to do vitamin tests, we may need to do thyroid tests, or so many other tests, B12 deficiency, iron levels, ferritin levels, especially in women. We may need to do all these levels. According to that, we'll give you medications. Sometimes, like I said, just basic vitamins and minerals, or we may just ask you for some modification of your lifestyle, or ultimately we need to go for stronger medicines like anti-androgens, other drugs which are FDA approved or non-FDA approved, which can stimulate the hair growth. We may need to do procedures like PRP or SVF, or now of course exosomes or GFC, or you may finally need a hair transplant. So get a proper advice done before you actually do any kind of self-medication. Hair loss is a big psychosocial problem, especially in young men and in women. When they lose hair, they are disturbed psychologically, socially, they find themselves to be introverts, they don't go out in the society easily. Especially, I see young boys who are at the age of getting married, or women who start losing their hair, they're not happy about themselves. Often they get treated in the wrong way, or they're doing the right treatment but not at the correct doses, okay, and not in the right manner also, which is very important. So always consult somebody, get proper treatment done. There are so many things which are available today. The only two drugs which are actually FDA approved for treating hair loss is minoxidil and finasteride. There is a lot of literature regarding both these drugs on the internet, which is often misinterpreted by the patients. Besides these, we have so many other alternatives which have come out today, and so many procedures, right from simple mesotherapy to microneedling to other complicated procedures. Finally, like I said, hair transplant is the only solution if you completely lost the root and you have healthy roots. Not all patients are good candidates for hair transplant. If you aren't a good candidate, that only can be determined by a thorough examination, physical examination, blood work, and by dermoscopy. Okay, so all these tests are very important, and of course, the right expectations for every patient. So yes, consult the proper qualified doctors in order to get all your queries solved about your hair loss problems.
For more such videos, visit or log into dermavidya.com.